here in the United States, as the national total now goes in excess of 90,000, heading up toward...
The president now has called for Congressman Massey, a Republican from Kentucky, to be removed from the GOP for saying now he is going to block this vote. The president yesterday at a briefing didn't call him out by name, but called him a grandstander by implication as well. That is, of course, Massey, named later by some of his colleagues. What is happening there? Do they have to have the 216 House majority in a roll call vote, which has prompted some of these members to start driving overnight from all over the country?
Yeah, Andrea, so in a tweet a short time ago, the president demoted Massey even further, calling him a third-rate grandstander. And it appears that Massey will do whatever he can do to force a recorded vote here. Now, I want to be really clear. This is not going to stop the passage of this bill. The most it can do is delay it. The bill is going to have overwhelming bipartisan support. Louis Gohmert, Republican from Texas, who had expressed a ton of reservations about the bill up till this point, just spoke on the floor and said that he would ultimately vote for it. So without getting too bogged down in the procedural elements of this, what it appears Massey can do is he can try to force a recorded vote or a quorum call, which functionally will do the same thing. It will require the House to prove that at least half of its members are here. 216 people would be required. Perhaps they'll go all the way through a recorded vote, but they have to at least get far enough to know they've got enough people to effectively have a quorum. How they will do this is a little bit uncertain. We've never tried to do something like this before. The House planned, if they had to do a recorded vote, to bring in members in small groups, 16 different groups of members across a period of time, to make sure that you didn't have the whole body or even a large group of them in the chamber at the same time. I've been in and out of the chamber all morning. There's probably been about 80 people on the floor all told at any given time. But as we get closer and closer to the vote, that number may go up. So again, we do expect to see Massey try to delay this with one or the other of those two moves here, either calling for a recorded vote or a quorum call. We'll see if there's any procedural tools left in the Speaker's kit to deny that, but it looks likely we will see this protracted count of members before there can be a vote. The only, I guess, real drama here is if they cannot hit that 216 threshold, and we have to just sit around and wait for more members to get back here from all over the rest of the country.
And just to reemphasize, Garrett, this is bipartisan, the leadership position. I was watching Liz Cheney, who is the number 3 in the leadership, and she was calling out for support for this. People on both sides are calling for this compromise where every side had to give up something. But this is what the Senate passed. The House has to pass it before it can get to the president's desk. Sort of.
Well, and it's clear Massey can't get this changed. Right. Massey can't get this changed. There won't be amendments. There won't be changes to this bill. He is trying to delay it out of principle for issues that he says he has with the bill and the way that it was put together. He's gotten some cover, by the way, from some other Republicans who have defended him on Twitter, including Texan Chip Roy, who in a sort of extraordinary tweet told the president to back off in his criticism, but also said Massey was principled, but he's not probably going to be here to vote because he can't get back from Texas. Sort of an interesting armchair stance for someone to take from, halfway across the country.
Garrett Haake, thanks so much. Thanks for being there. And joining us now, New Jersey Democratic Congresswoman Mikey Sherrill and Michigan Democratic Congresswoman Debbie Dingell, co-chair of the House Democratic Policy and Communications Committee. I know that, Debbie Dingell, Congresswoman, you are in Michigan because people were told to go home and it was going to be a voice vote. And so we'll talk to you from there. But Mikey Sherrill, let me see, where are you coming in from?
I'm here in Washington.
You're here in Washington. I know you're a military veteran as well. Let's talk about the need to get this done and get it done quickly. People need the relief.
We have so much need for relief in New Jersey. We have the second highest number of cases. They're rising every day. We don't have enough personal protective gear. We have people losing their jobs at an alarming rate. We need the direct checks. We need the support for the hospitals. So we really need to get relief out to people immediately.
And Debbie Dingell, there's fear of a major spread now from Detroit and the area around Detroit. That's becoming one of the hot spots, that and Chicago in the Midwest. Talk to me about you. I know one of your close colleagues and friends, Fred Upton, a Republican from Michigan, was driving in from Kalamazoo. He was one of the closest friends of your late husband, John Dingell. So the ties are very close, but he was getting in his car and driving 10 hours to get here for this possible vote.
He was coming to get me. Unfortunately, one of my staff people was tested on St. Patrick's Day for coronavirus, and we still do not have the test results back. This is how stressed our hospital systems are. I called yesterday, not asking for any special treatment, but just checking, and they were unable to give us the results. And out of an abundance of caution, I am not there. We all need to do our part to mitigate the spread of this disease, which means we need to stay home.
And talk to me about also what's happening in Detroit, because your district, well, the areas around Detroit in Michigan are now seeing a very sharp rise in the infection rate.
Detroit's now number 3 in terms of cities in the country, and I'm in Wayne County, which, like Cook County, is one of the counties that is becoming similar. Many people believe will be the FX like New York is right now. You know, a week ago, it's really hard to believe that just a week ago, the very first death in coronavirus was last Friday from my district, and that was 3 deaths by the end of the day Friday, and we're now at 60, and we're almost at 3,000 cases. The governor did do a stay-at-home order. Unfortunately, too many people did not take it seriously at first, and my mantra has become stay home, stay safe, save lives, and people don't understand that each of us has a responsibility to stop this mitigation. We don't have, Mikey was absolutely correct in everything that she said. My biggest concern, and I think every member of Congress's biggest concern, is the lack of PPE for these hospitals. I'm talking to doctors and nurses morning, noon, and night about their fear of being on the front line, not having the masks, the gowns, the respirators, the ventilators. We have to get that to them. And the president, quite frankly, has got to use the Defense Production Act to start to get a plan to get this equipment to where it needs to go.
And I just wanted to point out that AOC, Congressman Ocasio-Cortez, this morning was on the floor, and she is also speaking about the need for ventilators. She represents Queens and parts of the Bronx. Let's watch.
I represent one of the hardest hit communities in the hardest hit city in this country, Queens, New York. 13 dead in a night in Elmhurst Hospital alone. Our community's reality is this country's future if we don't do anything. Hospital workers do not have protective equipment. We don't have the necessary ventilators, but we have to go into this vote eyes wide open. What did the Senate majority fight for? One of the largest corporate bailouts with as few strings as possible in American history. Shameful.
Ocasio-Cortez talking about exactly what's happening in Queens, where Ron Allen is. Mikey, Cheryl, this issue of ventilators, the president was suggesting last night, I think on Fox, that Governor Cuomo is calling for ventilators and they really aren't needed. He's gone into hospitals where there are 2 ventilators and all of a sudden he's asking for 40,000. When you have the leader of the country disputing the facts that come from the governor of New York and coming from the ground and from the people that you're talking to there where you live, your district, how do you, the public is confused. Whom do they believe?
You know, if he can find any personal protective gear, I invite the president to come to New Jersey and to see what things look like on the ground. I am on the phone with healthcare providers in our hospital systems every morning. Our morgues are full. I'm in Montclair, New Jersey, much smaller than Queens, and we've had 9 deaths so far. We have people that are wearing trash bags because they don't have the personal protective gear they need. Our hospital workers are scared because they're treating people and yet they're not sure they're safe themselves. We have first responders who can't get the personal protective gear they need as they're transporting people with coronavirus to the hospital systems. This is critical. We have got to have the Defense Production Act working for us. I have spoken personally to manufacturers in my district who want to manufacture the PPE, who need some help with the supply chain. I've spoken to some of our large corporations to figure out how we're going to get PPE here, and they're weeks off. We need to speed up the production lines. It's not soon enough. I've been calling the Michigan delegation, and Debbie has been fantastic about trying to get our auto manufacturers to produce as quickly as possible the ventilators that we need across the country. And I can tell you, it is a desperate need. We're already talking in New Jersey about we're getting to the point of capacity with our ventilators, and we haven't hit the height of this yet. We're talking about what comes next.
And Debbie Dingell, I know you used to work before you were in Congress for the, or many years past, for General Motors, for the foundation, at least. I believe it's a nonprofit foundation. I'm not precise about that, but
no,
the president was tweeting.
For 30 years.
Okay, so I just want to point out that the president was tweeting this morning against General Motors. Here, he could order under the Defense Production Act, as Mikey Sherrill just said, tell them what to do. Now he's tweeting, as usual with this General Motors, things just never seem to work out. They said they were going to give us 40,000 much-needed ventilators very quickly. Now they're saying it will only be 6,000 in late April. They want top dollar, always a mess. And, you know, going on, talking about Ford Motor Company as well. He, with a stroke of a pen, could just tell them, you do this, you do that, and, you know, tell FEMA, and FEMA will divvy this stuff up.
So I've been talking to the auto industry every single day. I've talked to the CEOs every single day. There's clearly a lack of direct communication between the president and General Motors because they have never actually, they are trying to produce ventilators in their Kokomo, Indiana plant. They're working with someone that already produces it. They've not made the commitment, though I wish the president would do something to help get them up. Ford Motor Company quickly looked at it. It was too complicated to get the ventilators produced quickly in the way that they were needed. So they are now producing other PPE equipment and trying to find out exactly where it needs to go. Chrysler is making masks, all three companies. And as Mikey said, we're all talking to other suppliers and manufacturers that want to do their part. But we've got to connect them. Someone's got to manage it. We have had governors that were told last week by the president, and this isn't Democratic or Republican governors, it's all governors, that were told last week by the president, go out and get your own supplies. And yet, when they had gotten supplies and had them being shipped this week, suddenly the supplier said, we can't ship them to you because the federal government is taking over distribution. And yet the federal government isn't getting to the apex centers. We don't want to play partisan games. This isn't a partisan game. We've all got to work together. But we need processes that everybody understands, and we've got to get equipment where it's got to get.
Debbie Dingell and Mikey Sherrill, and as Congresswoman Dingell said, she was going to ride share with Fred Upton, her Republican colleague, but can't because she had a contact and is self-isolating, but still can't get a test. You can't make it up. Thank you very much to both of you. And NBC's Aaron McLaughlin, meanwhile, on the web.
That they're quite ready for that. And he would love to go back to remotely teaching his classes. I'm not sure that they're quite ready for that, but he is, I get to wave to him out the window today because just as Walter Isaacson was just saying in that important segment, there's just not enough information out there yet. And I agree, in 5 to 6 weeks, we're going to know a lot more about when people aren't contagious. They think he still could be because he's still coughing. And all of these things, people need this information. But right now, as you know, they need ventilators, they need help. That's why that vote is going on in the House. I find it frustrating that one member from Kentucky, Congressman Massey, can hold up this whole process, but that's what he chose to do. I'm very pleased that in the U.S. Senate we had a unanimous vote to get help out to people for unemployment, to make sure that we've got help for small businesses, and then, of course, the equipment that should have been there a long time ago, but the planning was not done when this first struck in China.
Now, you cast your vote in the Senate while your husband was in the hospital and while you were so worried about him. At this stage, what are the doctors telling you about how can they test him to make sure that it's safe for you to go home and be with him?
But no one really knows. They're just waiting to let some time pass so he's not showing the symptoms. And, you know, you just wait. I really do want to stress, though, that our problem is so small right now compared to everyone else's who have people that are in the hospital who, like me, cannot visit those loved ones, some of them much sicker and getting sicker than he was. The people, the seniors who are in their houses and can only have their friends and loved ones visit them through a window. All of this is happening right now, Andrea. So I think it is important to put things in perspective, to get the help out there we need federally. And just my story, if anything, I hope it's helpful for people to realize, follow the rules. And we did, but at least he didn't get me sick or other people sicker. Why? Because he followed the rules. And I think that the more people that do that, it's really, really important. You're going to save lives.
Now, of course, one of your colleagues did not follow the rules, as far as we can tell, because Rand Paul tested positive last Sunday. I think it was Sunday, after being in the Senate gym.
Yeah, well, you know, I'm not going to comment on his situation. I just know that every time you don't follow the rules, you're putting someone else's life in danger, whether it is the healthcare workers on the front line who need that equipment, whether it's the grocery store clerk who's sitting there just getting food out to people. This has got to be a team effort. And I think leadership means making that really clear. It's a tough, tough time, and it's hard for everyone. But if we do this together, we're going to save lives. We're going to get through this together. And that's what we're doing right now. And I'm glad all those House members are coming in there to take that vote, because we need to get the relief out to the American people.
I was very struck in watching the House floor debate in seeing Ocasio-Cortez and Liz Cheney, two very disparate political wings of each of their parties, one conservative Republican, obviously, and one a very progressive Democrat, all calling for a vote in passing a bill that a lot of which they didn't like. They saw the need to compromise. And I think that is the message. What is your message now? I know you just mentioned Congressman Massey, but what would you say to him about his resistance today?
Well, I probably first tell the story about my husband and how close it was and how scary it was that this can happen to anyone, and it's going to happen to people that he knows. And the second thing I would say is that this didn't have everything that I wanted. I wanted more funding for voting at home and mail-in ballots, because that's what we're going to need in November. And I got some, but not what I wanted. But was I going to turn away and vote against that bill because of that? Absolutely not. Our cities still need more help. We're going to need more equipment out there, but we have to respond. We know that people are, through no fault of their own, being uprooted from their jobs every single day. And this is a country that has each other's backs. We have come through horrible crises before. We will come through this, but not if we play politics with it. And I think that's why you saw liberal Democrats and conservative Republicans, I would say, joining hands, not quite, that would be against the rules, but joining to support this bill. And one of the things that's also bothered me through this process, of course, is some of Donald Trump's rhetoric and the blame and not always getting the facts out. And I think people have to step back, listen to their governors, look at how we can make regional responses if we're not going to get the testing out like we should, and be the great country that we are.
Do you have some concerns that the president now is going to be pressuring the scientific advisors? There seemed to be a change in posture from Dr. Deborah Birx last night. A lot of people were concerned about some of the things she said about new modeling. The vice president said that he was going to get a report from the medical advisors this weekend as the 15 days draw to a close as to whether some parts of the country can be, go back to business.
I think we have to listen to the doctors and the scientists. Clearly, some parts are hit more than others. But what we've seen right now nationally, not just in one city, is right now we are on the ramp up of the number of cases, on the ramp up of the number of deaths. And so this isn't the time where you send this mixed message, oh, stay in your house, but don't stay in your house. I think we need a federal message. And of course, at some point, certain industries and areas, you start figuring out how they can go back to work. Of course you do. But it feels to me that it is just much more one of his, oh, let me say something out for the spur of the moment without consulting people, than it is actually a plan moving forward. And that has been the whole problem from the beginning. This is a global pandemic, Andrea. It is. But a lot of these errors that were made early on of not getting ready and the tests, those are man-made errors. But we'll have plenty of time to talk about that later.
Senator Amy Klobuchar, our best to you and your husband and your daughter and the whole family. Thank you very much.
All right, thank you, Andrea.
You bet. Coming up next.
That's an understandable circumstance. We said 90 days because we don't know how long this is going to go on. We could always revisit it. But for now, for 90 days, by law, the landlord cannot evict you. All right, let's go to work, guys. Thank you all very much. Let's give them a big round of applause.
The help of the Army Corps of Engineers. As always, some big headlines and some sad headlines out of the Governor Cuomo's daily briefing. New York, of course, the epicenter in this fight. The governor announcing New York's case total now up to 44,635. Just look at the number on your screen there. New York, almost half of the national total here in the United States, as the national total now goes in excess of 90,000, heading up toward 100,000. The governor also announcing the death toll in New York is now 519. That is a day-to-day increase of 134 from yesterday. Yesterday it was in the 300s, now 519, and again put New York's deaths in the context of that national number at 1,353 and rising. The governor also saying he believes the apex is still about 21 days away. Come back to that conversation in a moment with our guests, and the governor returning politely, but returning the fire of the President of the United States on the question of how many ventilators New York needs. Let's continue the conversation with our senior medical correspondent, Elizabeth Cohen, and emergency room doctor Nathan Allen. And I want to start with this. The Surgeon General, Jerome Adams, was on National York is having a horrible week, but he sees the potential for progress. The governor saying, not so fast. Let's listen.
We're hopeful that next week New York will start to come down because, again, their cases have started to level off.
Now we're looking at about 21 days for a possible apex.
Elizabeth Cohen, let me start with you. Nobody knows for certain, but the governor is not as optimistic as the Surgeon General, clearly.
Right, absolutely. And I think that there's great reason for that. The infectious disease experts and the epidemiologists that I'm talking to are much more where the governor is. They say that this is about the amount of time that they would expect to see the apex. And remember, that's just the apex. You then, the outbreak is still going on. It may, after the apex, it will get better, but it will still be bad. And what I want people to remember is that what happens in New York is likely to happen other places. John, we're all familiar with the flu. You don't get the flu just in New York or just in Los Angeles or just in Washington. The flu eventually covers the entire country. This virus, in many ways, much more contagious because people spread it before they even know that they're sick, which is not typically how the flu works. So when we all look at New York, we should know that it very well could happen where we live too.
Right, and it's a great point. We focus a lot on New York, not just because the governor gives the daily briefings, but because it is the epicenter right now. But as he calls it, the canary in the coal mine, Dr. Allen, and come in on that point. The governor saying, look, the cases are up. The death toll, sadly, is up. He does say, though, that if there is a silver lining, and I'm not even sure I would use that term, it sounds too optimistic, but that the rate of hospitalization, yes, hospitalizations are increasing, but the rate of the increase has slowed some. What does that tell you about, is that just the proof that social distancing works?
I think it's proof that social distancing is working effectively. You know, I'm an emergency physician, and the essence of what we do and what a lot of other healthcare workers do is save lives. But our best days at work are the days when we don't have to save somebody's life. And so I think the message that he's getting out about stopping the spread, flattening the curve, and saving lives is one of the most essential ones right now.
It is essential. And, Doctor, let me stay with you for a minute. Take me inside as we listen to the governor, and he talks about the need. 4 temporary hospitals already set up with the help of the Army Corps of Engineers. He's going to ask the President of the United States for 4 more today. You have a naval vessel with 1,000 more beds approaching New York Harbor. Should be there by Monday, I believe, is the latest estimate. What are you seeing in the emergency room today as opposed to yesterday and several days ago?
So, where I'm working right now, we're still a little bit behind the curve from where New York is, and that's why we're trying to do the best that we can to stop spread and prevent the situation from becoming as dire as it is in New York. But our hospital, as are all hospitals around the country, are actively building our capacity and working to increase that, to try to raise the availability to meet the surging need. And so, you know, in our hospital, and the governor there talks about ventilators, we've work to try to triple or quadruple our ability to run patients on ventilators and provide critical care services if that becomes necessary here in Montana.
Right, it's remarkable to watch here in Montana, people around the country learning lessons as we watch other places go through it, anticipating, let's hope we're wrong, but anticipating the case count will go up everywhere. As we noted, the president just this hour venting new frustrations at General Motors, that over the number of ventilators he says they promised to deliver Always a mess with Mary B. That's the president of General Motors, Mary Barr. CNN's Caitlin Collins joins the conversation from the White House. Caitlin, before I get to the General Motors conversation, I want to go back to the governor of New York just moments ago. The president went on Hannity last night. Well, let's do it this way. The president went on Hannity last night and said this.
When you talk about ventilators, that's sort of like buying a car. It's very expensive. It's a very intricate piece of equipment. Governor Cuomo and others that say we want, 30,000 of them. 30,000. I don't think that certain things will materialize, and a lot of equipment's being asked for that I don't think they'll need.
Caitlin, here was the governor's response. He was not as emotional as he has been in some past briefings, but he said, everybody's entitled to their own opinion. I don't operate here on opinion. Then he went on to say, I feel, I think, I believe, make decisions based on data and on science. So another confrontation between the President of the United States and the governor of New York.
Yeah, the president didn't mention Cuomo specifically during that quote last night on Sean Hannity's show, but clearly we know Governor Cuomo has said he needs 30,000 ventilators. And the president was downplaying it last night, talking about how some major hospitals only had 2 ventilators, he said in the past, essentially raising this question. And of course, the reason New York needs 30,000 ventilators, they say right now, is because they are worried about this crush of patients that they're already seeing. They're worried about what's to come in the next several weeks. And so it's really notable that you saw the president downplaying those ventilators last night and that need that we've heard from hospitals, because he's doing the opposite on Twitter today. And he's in the middle of this feud with GM right now because, as CNN reported, first reported by the New York Times, we've now confirmed there was going to be this announcement that the administration was planning on making with GM and another company to talk about producing thousands of ventilators. But it has hit a snag. It's essentially being reassessed. We were told it had not been called off. But if you look at the president's tweets this morning, he's clearly not happy with GM. And the reason that those talks hit a snag when they came pretty close to being announced was because they were worried about how long it was going to take GM and this other company to make these ventilators, and also the price tag on it, because not only were they obviously going to have to pay for the ventilators, but GM, we're told by the White House, also wanted them to pay to retool their factories, because currently they don't make ventilators at this plant in Indiana where they were expecting to make these. So the question here now is, how is this going to move forward? Because it's been a pretty clear need that they need more ventilators. We know they're looking at other options. Right now, there is no agreement with GM to move forward to make these ventilators. And you see the president continuing to lash out. Another tweet he put up just after that one you read there. He said General Motors must immediately open their stupidly abandoned Lordstown plant in Ohio or some other plant. And then he goes into all caps. He says, and start making ventilators now. He also calls on Ford to get going on ventilators fast. Okay, one thing I want to note, GM sold that Lordstown, Ohio plant last year to a vehicle startup company. They don't even own it anymore. But really, walking out of this, John, what people are going to be asking is if this is going to encourage the president to invoke the Defense Production Act to actually require government mandate these companies to make these ventilators instead of just being in talks with them and having them do on their own as they've been doing so far.
And help me through this a little bit, Caitlin, because this is another example, like the Google website, of the president now venting and lashing at somebody else, blaming somebody else after he has publicly overpromised. However, he has promised something that is way ahead of the facts. He said Google was going to have a national website. Google was still trying for a regional website in the San Francisco area. He has said these companies would be ready to produce ventilators, leaving the impression it would be quickly. They have to retrofit their factories. Last night, he lashed out at several governors in his remarks as well. What do we know inside about the source of the president's frustration and anger?
Well, the question here is, when it comes to something as specific as ventilators, is the president is downplaying it, and then now he's, getting hell from other governors because they say they do not have enough ventilators in their hospitals, and now the president is calling on these private companies that they've already been in talks with about making these ventilators to speed it up. Of course, as he himself noted last night, ventilators are a pretty complex machine, so it's not something that you can make as quickly as something like masks, which has also been another question of whether or not there's enough in these hospitals, because you're seeing doctors and nurses say they don't. But the thing with ventilators is this is not a new problem. The administration has known about this. This has been a problem that has been on their plate for several weeks now. It's something we've been quizzing them about almost daily at these press briefings, about how many they have in the national stockpile, whether or not it's going to be enough, and how many they are projecting that they are going to need moving forward as they are dealing with all these coronavirus patients. So this isn't a new problem, and this is why you've seen governors call on him to use the DPA, because then the federal government is asking these companies to do this in a government mandate. But so far they've argued it's not necessary. Of course, the president seems to be making a different case case on Twitter. So that is the question is going to be, is whether or not there are going to be enough ventilators, which we should remind people are going to be life-saving machines for people who have worse cases of coronavirus.
Right. You get the sense from the tweets the president, as he often does, is trying to make it somebody else's problem. Caitlin Collins, appreciate that. Live at the White House. We're going to take a quick break. When we come back, Detroit, suddenly a surge city when it comes to the coronavirus. Why? Angeles, that is a welcome docking, Stephanie.
Right as I said it would at 8:30 local time, the naval ship here with more than 1,000 beds, and this is very welcome to Los Angeles. The mayor of Los Angeles, Eric Garcetti, saying that Los Angeles could be where New York is in just 6 days' time. So we're pacing behind them at about that rate. So therefore, they're looking for more bed capacity here in the area to make sure that they are clearing out people who still have a myriad of health concerns that are not COVID-related. And that is where the Mercy comes in. This ship will take those patients, take them here so that they can alleviate some of the stress on the hospitals on land and also free up space to allow for more COVID patients. That will also free up ventilators. That means that more patients could perhaps be in the same room. I spoke to a local emergency room doctor who says that after a COVID patient is in a room, it's a couple of hours that room is out of service because it has to go through a deep cleaning. So if you think about what that means as far as space for patients who need it, that is huge. So what this hospital does, it's a full service hospital here. They can do surgeries on board. All of that will help relieve that tension. What the other thing that they're doing is that they're working with local and state officials to make sure that they're getting the right people and sourcing them here to this floating hospital to get them here. That's what they are working on. I know we're taking a look at the numbers for California overall right now, talking about 3,000 cases, more than that, and also the deaths of 65 people. Well, in LA County, we're looking at 21 deaths so far and 1,200 cases. So obviously this is another hotbed in the country, and that is why they are working to make sure that they have the bed space, because they do believe they are going to need it, even though we are not at capacity right now, John.
Right now is the question, Stephanie Elam. Appreciate that live report. And as we salute the first responders and the medical professionals around the country, remember that's members of the United States military as well on that naval medical ship now in L.A. In one of the hardest hit states in country, Michigan, seeing a staggering surge in reported cases. Now more than 2,800 compared to just over 500 cases a week ago. Dr. Janae Khaldun, one of Michigan's top health officials, spoke with CNN's Allison Camerata this morning, warning her state struggling to keep up.
I've now got doctors and nurses on the front lines who are using one mask for their entire shift. We got a shipment from the Strategic National Stockpile a couple of weeks ago that actually had no N95 masks on it. So no, we don't have enough. Also, we're going to need to build alternative care sites, and we're currently looking at that, and we need staff to help us get those up and running very quickly.
Joining me now to continue the discussion, Robin Erb, the health writer for The Bridge magazine in Michigan. Do we know exactly why they were starting to see this surge in Detroit?
Well, there are a lot of theories and probably some pretty good thinking out there about this. You know, one of the first things is we're an international hub for travel. Detroit Metro Airport is very busy with students and with business travel. And we were one of the 11 airports, if you remember, in Detroit that was taking doing the extra screening for folks coming from China. So you have that international hub. You know, part of it also, just like any metropolitan area, we have areas that are very densely populated, so that's going to help that spread. And then, you know, what's really unique to Detroit is even though we have this great economic revitalization going on right now, and there's a lot of great things happening in it, we still have these areas of deep poverty. And that means lack of access to health care. And that in turn means, you know, those chronic conditions going unchecked, hypertension, diabetes, heart disease. And those, as we know, make you more susceptible to the severest symptoms of COVID-19.
And so this story is going to be with us for months, and it is going to move around pockets of the country. We're heavily focused on New York for obvious reasons, the giant caseload there, almost half of the country. We saw this, we followed this in Seattle. We were just touching base in L.A. and California. When your governor came out yesterday and announced that dramatic increase in cases, it's just one of those, your head snaps back, and you realize every day, you know, where is it going to come up next? What is the perspective there about, you talk about, you know, there's inner city Detroit, but then you have a state with rural areas as well, about the resources resources, the availability, the supply line? Where is Michigan?
Well, you know, Dr. Khaldun, who you spoke to earlier today, she was one of the first people who raised the alarm several weeks ago saying, we don't have enough. You know, we don't have enough of the personal protection equipment protective equipment we're hearing about across the country. We don't have enough ventilators. And that's become really acute in the last few days. Our Metro Detroit hospitals are getting overwhelmed. And, you know, they're asking for donations. They're struggling to, you know, use those masks all day, the masks that are supposed to be disposable. So we've got some really anxious healthcare workers out there right now.
Let me ask you a question. I'm not sure it's a fair question, but let me try to ask it anyway. In the sense is, as this plays out, your healthcare system is stressed. You mentioned the specific challenges of inner city Detroit. Overlay that with the anxiety and the stress of the economic hit, Michigan taking a big piece of the economic hit here as well, in terms of what that does to the healthcare system.
Well, we've got healthcare systems very, very much worried about their bottom line. And they're saying, of course, absolutely, of course, the first priority is for patients. But, you know, we already have some healthcare systems that are struggling from time to time, and they are worried. That right now they're more concentrating right now on, you know, kind of balancing that load of patients. Right. But they're very worried.
The difficult days and weeks ahead. Robin, I really appreciate the perspective from Michigan. It is. It's a tough time. And again, we watch this when it's going to pop up in different places at different times around the country. It's part of our reporting challenge. Really appreciate your help from on the ground in Michigan. And as the number of confirmed coronavirus cases around the world tops 500,000, how close are we to finding a vaccine? Or Dr. Michel Nussenzweig, investigator at the Howard Hughes Medical Institute. He's also part of a group at the Rockefeller University Hospital working on a coronavirus clinical study. And Natalie Dean, assistant professor of biostatistics at the University of Florida. She specializes in vaccine trial development. Dr. Nussenzweig, let me start with you. You're involved in a clinical trial right now. Explain to our viewers what it is and what the hope is.
Okay, very good, John. So what we're doing is trying to obtain the antibodies from people that are excellent responders to the virus so that we can reproduce them and give them to other individuals to protect them from the virus or potentially treat the virus. It's very similar to plasma therapy that you've been hearing about and that I heard Dr. Fauci talk about yesterday on your program. But instead of using plasma pooled for many individuals, something that is not scalable, we're going to get just the very best components of that plasma and be able to reproduce it so we can give it to a lot of people.
And the timeline, your guess?
The timeline for this is very similar to vaccines. It'll take a year, just about a year, to be able to do something like this. But we're in the midst of recruiting people to be able to do this.
And Natalie, come in on the timeline point, because a lot of people are watching. They want to know when there might be treatments. They want to know when there might be a vaccine, especially if we assume this will come back to us in another season down the road. Let me try this in layman's term. If 1 is the starting point and 10 is the finish line, where are we in terms of vaccine development? I know there are a number of different attempts out there. Where are we? And again, what is realistic for people to think in terms of when it might be available?
Hi, John. Yeah, thanks for having me. So on that 10-point scale, I'd say maybe we're still at the 1 or the 2. I mean, things have been moving extremely quickly. People are working very hard, but there are a lot of necessary steps before a vaccine can become available to a wide population. That includes animal testing, but because this is a new disease, we don't really have an animal model. And then these early in-human trials, and then the big trials where we demonstrate that the vaccine's safe and effective, and then finally actually manufacturing the vaccine at scale.
And Dr. Nussenzweig, as you go through trials, you need patients to help you in those trials. Is that an issue? Do you have availability of everybody you need to run through the testing that is necessary to know, A, it works, and B, it's safe?
Well, we're recruiting, John, and we're asking volunteers who have recovered from the virus to come here so that they can donate samples so that we can find the best individuals and do the antibody cloning.
I'm sorry, go ahead.
Website where you can go, and I believe we sent you the link so you can provide it to people who want to volunteer.
Great. We will do that as we do this. It's a challenge. And Natalie, as the conversation has played out, we're obviously learning every day new things about this virus as we get more testing ramped up around the United States, as you get more patients treated, and you learn more about it. In terms of when people do talk about it in the context of like the flu, Dr. Fauci has talked about this. Maybe as the weather gets warmer, the cases do go down a little bit, but it cycles back. Are we certain about that, or are we still studying the novel coronavirus to figure out if that's a fact?
Yeah, I have never been too convinced about the argument that it might go away in the summer. The reality is we are seeing cases pop up in the southern hemisphere. We're seeing some transmission there, and in places like Singapore that have a humid climate, we're seeing transmission. So there's not really enough evidence to think that it will go away in the summer, just like the flu.
And Dr. Nussbaum, this is a global challenge. You're focused on your work. How does the collaboration work here? Is there people off doing what they think is their best thing with their small group? Are there constant conversations with colleagues around the world to try to learn the lessons of China, the lessons of Spain, the lessons of Italy, to get the larger mass, if you will, the larger database to study?
John, this has been an incredible experience in just how collaborative scientists can be from every different discipline. Our team is working with people all over the world and all over the country to try to do this as rapidly and as efficiently as we can, and to learn from each other so that we don't make any mistakes.
Well, I want to thank you both, A, for coming on to help us explain this today. It's very complicated. We want to make sure we do this fact-based. That has not always been the case during this story as it plays out. We appreciate both of you for the work you're doing and for your insights here today. Can't thank you enough.
Thank you.
Let's discuss the Massachusetts and National Challenge with Dr. Andrew Ortenstein. He's the Chief Physician Executive and Chief Academic Officer at the Bay State Health in Massachusetts. He's also an infectious disease specialist. Doctor, what's happening in Massachusetts? Again, we're watching the epicenter in New York. You see these spikes in some of the larger urban areas, a big increase in Michigan yesterday, a big increase in New Orleans. Put Massachusetts into context for us as we watch as this spreads across the country.
Well, thank you for having me. I think we're at the very early phases of the upslope in the curve in Massachusetts. Certainly at Bay State Health, which represents about 1 million people in Western Massachusetts that we care for, we are just seeing probably week number 1 or week number 2 of the upslope in the curve, but we're starting to see more evidence of community transmission, although with limited testing, it's hard to confirm that.
Well, you talk about limited testing. I want you to listen here to Dr. Anthony Fauci. And again, we applaud any progress. It is nice to hear from the White House, and it's nice to hear from some of the states that they're starting to ramp up testing. But my question is, where are we now? First, Dr. Fauci.
It needs to be ratcheted up, Anderson. We've got to do it better than we are now. Not that we're at fault, that no one's made any mistakes, but they've got to elevate it to the point where when you have someone in society who is infected, you've got to not only identify them, but you've got to be able to isolate them very quickly, not 5 days later after they wound up potentially infecting individuals. So we've got to get that system where you identify somebody and as quickly as possible get them out of a situation where they may infect other people. That's what's called strict containment, and that's what we've got to do.
So if that's what we've got to do, Doctor, when will we be able to do it in a way that allows us to have a fair representation of how many people have this, how many people had this, and is it time, as the President says, to start backing off, or do we need to dial up?
Well, I think I agree 100% with Dr. Fauci and our national experts. We need to dial up. We're not there yet, and I can't give you the answer to that excellent and valid question. We are at this moment.
What does that tell you? I'm sorry to interrupt you, but I'm sorry to interrupt, Doctor, but what does it tell you that you're on the front lines and you can't give an answer to that question? What does it tell you? Whose fault is that?
Well, I don't know who's at fault, but I do know it's very tough for the 12,000 people I have that are in harm's way taking care of our patients and trying to stay safe.
Right. Well, hopefully it gets better. I want to ask you a couple of questions we get from our viewers, because this is the most important, to me, this is the most important part of the program. As we update people around, we have people sitting at home who don't know what to do, who are getting conflicting information, including this debates about testing, debates about PPE, should they get a test. Let me ask you a couple of our questions here. There are rumors that certain blood types, i.e. the O, is less susceptible, not immune to the virus. Let's say A. Any truth to that?
Not that I know of. It's possible, but I just don't know that there's evidence to suggest that at this point.
Okay, here's another one. People are told if you think you have a fever, that would be a sign perhaps. Here's another question. Is it common for body temperatures to fluctuate widely during the onset of COVID-19? My spouse returned several days ago from business trip to Seattle. He's self-quarantined and taking his temperature every 2 hours. Today it varied between 97.5 to 101.5, up and down throughout the day.
The human body does vary somewhat, but once you get over 99.5, it's an abnormal temperature.
Once you get over, so you should keep an eye on that. Here's another one that's close to home to you. I'm a nurse in a Boston hospital. Like China and Italy are a model for the United States, New York and Washington are a model of what we will soon be facing. Can you please reiterate the fact that if healthcare professionals are not protected, they will infect healthy patients if they're even well enough to continue to come to work? That's more a statement, I guess, than a question. But when it comes to this PPE, when it comes to the knowing that maybe you have what you have today, are you confident you're going to have what you need tomorrow, next week, and the week after that?
I'm not confident. We're working as hard as we can and trying the best we can, just like everyone else nationally. We are in scarce situation with personal protective equipment.
I know your governor. I'm a Boston kid, and I know Governor Baker. And to see him emotional like that, a lot of people, there are questions about, whether the state should have more restrictions and the like. But to see him frustrated on the procurement front, saying essentially that they have orders confirmed and then they disappear. There's a competition around the country, as you well know. What is your experience when it comes to trying to get it? Whether you're trying to get it yourself for your hospital system, or trying to get it through the state or through the federal government, is today better than yesterday or more confusing?
We're better in terms of the options, but in terms of deliverables, I can't say with absolute certainty that we're going to have what we need when we need it. We're trying to conserve as best as we can, and I agree 100% with the governor's frustration. Asking healthcare workers and others to take care of sick patients, which is what they sign up to do every day, we need to be able to protect those people.
Doctor, we're grateful for your time here on the program. More importantly, we're grateful for the work of you and all of your colleagues as you go through this, especially given the added stress of worrying about your own safety and supply chain. Really appreciate your help as we try to put this into context.